Hey everyone. Um, I got a hip replacement. I'm just gonna put it out there. I know that I started that channel to try to not need a hip replacement, but it just was getting worse, and I gave it a good shot. I gave it the college try, and I went through everything. I went through physiotherapy. I went through fascia stretching. I went through spinal decompression, and all those things provided some value and allowed me to continue to do things like golf and walk the course. And my guess is maybe I would have been better off if I just stopped everything and focused on recovery for like a year or two. But you gotta enjoy your life too. So I've been golfing. I golfed right up until Sunday, and Monday was my surgery. So this is day one, and just wanted to give you a bit of an update. So this report is really based on my experience here in Ottawa, Canada, at the Queensway Carleton Hospital. So take that for take that for what it is. It's just my experience, but just to give you some things that I didn't really think about. Sorry, just getting it. Okay, so it started off in the morning. Checked in at 6:45. Waited in the day surgery waiting room for about an hour, then was called back, got registered, uh, made my way to my little booth, put on the gown and put all my stuff in a bag, and then had a really nice nurse named Caitlin who kind of did all the intake, asked me a bunch of questions, and it's funny because every time someone came by to do something, whether it's check my pulse or something, it'd always be the same three questions, like what's your name, what's your birth date, and why are you here, right? So I'm sure it's just about to make sure that they got the right person and you're at the right place. So I'm checked in, I'm getting ready. They wheeled me into the block room. This is where you talk to the anesthesiologist. That's where you get the anesthesia. I had thought about going general anesthesia because I'd never been actually admitted to a hospital, never had a surgical process. So I'm kind of like, I think I want to just be knocked out. The last thing I want is some kind of sedation where I wake up and I'm watching the guy hack off my femur. But after talking to the anesthesiologist, I opted for the epidural and the nerve block, and mainly because they're like, look, even if you come to, we're going to put you out under again, and you're not even going to remember that, and it does make the recovery part of that day much easier. So, I'm home. I was there for maybe 5-6 hours total. I got there at 6:45, and I left around 3:30 that day. So it's not bad for a total hip replacement. So yeah, all I remember, and this is weirdness number one, and obviously I think anyone who's had procedures, it's probably not that weird, but it was weird to me. I remember getting the epidural. I remember him starting, all the sedation, the IV sedation. I lay down. I could feel myself being wheeled into the operating room. I could hear them talk about, like, okay, on three we'll lift and move him over, and I felt myself onto the operating table, and then that's it. Next thing I knew, I woke up. I was in the recovery. This nice nurse was asking me how I felt and if I could wiggle my toes. This is so weirdness number one. It's like 2 hours out of my life gone that I have no recollection for it. Literally, it felt like I closed my eyes, I opened my eyes, and that's it. And I have like this bionic hip. I have this metal femur and acetabulum and recovering. So, but no recollection, nothing. I don't. I have no clue if I woke up. I have no recollection of any sort, and I had no nausea, no headache. Felt really good. I felt hungry because I hadn't eaten since the night before, so they gave me some food, and and then weirdness number two. She's like, "Okay, can you wiggle your toes?" And I'm like, "Sure." And I looked down, and they weren't wiggling, and I was like, "What the?" And I couldn't move my legs, and it was like I was paralyzed. And no matter how much mental thought I put into it, there was nothing happening. And she's like, "Yeah, don't worry about it. It's just going to wear off. The epidural will take a couple hours. You could feel it right up into the evening." But within probably an hour and a half, it had slowly come back. I was wiggling my toes. I was lifting my legs enough that I could see physio. I could go through the exercises with them. I could walk down the hall, go up the stairs, go down the stairs, show them that, I'm mobile. And then they released me. So I'm home now. I am healing here at home. Um, and oops, so just kind of here's this is my game ready ice machine with the hip and groin. Oops, yeah, the hip and groin attachment there. It goes around my hip and groin, and this thing is filled with ice, and so it's supposed to speed recovery. I do it so I do it 30 minutes on, 60 minutes off, and it's really good. It's expensive. It's it's a rental, and it costs a lot of money, but apparently it can really help speed recovery. And then I'm in my room, so I have my TV, my laptop, and yeah, in general everything. I'm pretty comfortable, and yeah, and so they gave me. So I have my meds. They're some an anti-inflammatory, one for pain, one for blood thinning, so you don't get blood clots, and two narcotics for pain. So we'll see, because I'm still on the nerve block. I'm not feeling a lot of pain. I'm able to walk around slowly. I've gone downstairs to make myself breakfast, and I hung out on the couch for a while and just doom scrolled on my phone. Came up, I can use the bathroom. So by and large right now I feel pretty mobile, but I'm told the nerve block is going to wear off probably by tonight. So it'll be interesting to see what the pain is like. And I don't know what to say. I've been dealing with pain for what, a couple of years now, so it's not like it's my goal is not to take any of the narcotics. I'm not a big pill fan, but I'll do the Tylenol and the blood clotting, blood thinner one, and the anti-inflammatory, because I've taken those and that's fine. But generally speaking, um, my process is you're supposed to get up every hour, walk around a little bit. So I'll walk around upstairs. I'll do my exercises. There's about 4 or 5 exercises I got to do that really, they either work your quads or your abductors, really light stuff like heel slides and things like that. So nothing extravagant. And then I'll throw the ice machine on for the 30 minutes. And yeah, so in general, right now, today, feeling really good, feeling like nothing different, especially because I can't remember anything. Like I feel like I haven't done anything. I just, you know, as far as I know, there's like, and I don't even know. Maybe they didn't do anything. I know they did, but you don't know because there's no recollection. So yeah, today's good. I will give an update every day this week as my first week, and then after that, I'll probably just go to weekly updates. But yeah, I plan to at least do updates for the first 2 months because that's really the intensive rehab. And you know, hopefully, if you guys are along for the ride or you're getting ready for this yourself, you could get some good. You, you'll have a little bit of awareness, at least for what to expect on that first day, especially if you're doing anything here in the Ottawa, Ontario, Canada region. So thanks very much for tuning in, and I'll see you in the next video.